much, Dr. Lee Herzig, for being with me today in our discussion on natural effective results using an integrative method for Lyme disease. Thank you very much for joining me, Lee.
Good. Thank you for having me. Appreciate it.
So you've got, you're up in Maine, so you see a lot of Lyme, I am sure. And
We do.
I think it
seems to be increasing every day, literally, basically. Seeing more and more of it all the time.
And so has that been increasing in more recent times?
I've only been here 5 years, but yes, since I've been here talking to the other veterinarians and my own experience, it just is definitely increasing exponentially. And I think it's coming up from your part of the woods.
I think so. You know, the ground zero seems to have been Connecticut, and it's gone really crazy around the country. We'll cover some maps as we move in. I just wanted to continue on your introduction a little bit. You are in Belfast area, and you've been using alternative methods in your practice for quite a while. I see that you've been involved with acupuncture. When did you start with acupuncture, Lee?
I started in the early 90s. I started actually with herbs a little before that, and chiropractic, and then acupuncture the early 90s. And I had an integrated practice out west, but then when I moved to Belfast, I just strictly holistic.
So you just started to specialize more in the holistic approach. Yeah.
Right.
So how do you get your referrals? Are other doctors referring into your practice because you're specialized?
After about 4 or 5 years, initially not from the other veterinarians, so basically people are just looking for alternative methods, or the other the Western medicine's not working, so they sort of seek us out.
And just moving on to the next slide, just a little introduction on myself. I'm an acupuncturist and herbalist in the human realm, and we've been helping veterinarians, use herbs in their practice for about 10 years. And all of these slides, just to let everyone know, that all the participants in the seminar today will receive a PDF copy of the slide, an article online, and also some information on broccoli sprout powder, which is part of our protocol. We'll move through just into the idea that Lyme is a very nasty bacteria, a very large one too, and it's carried primarily, far afield by the deer, and of course other carriers are chipmunks and mice, but they're not taking it far afield as the deer are. And so, in a quick nutshell, a holistic approach is more integrated because some of these Lyme cases are so difficult. We also consider antibiotics, and there are some great herbs to help counteract Lyme disease and also the co-infections of the Lyme. And we'll be talking a little bit about the use of probiotics, especially for intensive antibiotic use. So there's a picture of the bad guy here, the Borrelia burgdorferi bacteria, and we can see you've got a lot going in your neck of the woods up in Maine.
Yes, definitely.
So that's 2007. What kind of percentage of your practice do you see Lyme, especially during the summer?
That's an interesting question. I see a tremendous number of animals that are Lyme positive, but they have no symptoms whatsoever. So, my feeling is that they've built up an immunity to it. I see a lot of cancer patients and everything else, so percentage-wise it's hard to say, but I'd say the number of animals that come through the clinic that have at least been exposed to it is probably 50 to 70%, a large percentage.
How was it when you were in Washington? Because you were in Washington early,
Very few.
Yeah,
very
so
few.
A little there.
We weren't looking for it as much either, I have to admit. But no.
This 2007 method is the human cases of Lyme, and by many people's analysis, this represents maybe 1/10 of the infections that get through and are actually reported to the FDA. And then we have the Lyme disease on the rise, and so we can see that from 92 it's really increasing in the human realm and being reflected also in the animal realm. This is more from the hot spots. We can see that New York is still the first. Massachusetts is in the last 5 years has really overtaken Connecticut in human cases. And so it's a very interesting question, Lee, about where Lyme originated from. There are all kinds of theories bouncing around, but there is some evidence that it was, in 1884. It can be tracked back, preserved in a fox. It's recently been found through DNA testing, and again in 1894 that there was DNA specimens of maybe a mouse in 1894 that were identified. And the symptoms that cover are amazing. The variety of symptoms from the nervous system, Bell's palsy in humans. We've got meningitis, jabbing pain, activity, system through arthritis, migratory joint pain, swelling, circulatory system. So it's a very broad range of symptoms it's producing in animals and in humans.
That facial nerve paralysis, that's the first case I saw it when I came to Maine, and I missed it because I wasn't even looking for it. The dog was absolutely normal otherwise, had this facial paralysis. Oh, I'll get my acupuncture needles out, and I'm going to treat him. And he just wasn't getting better, and then I'm going to check him for Lyme's. And like 2 days after I put him on supplements, he was better, So it
straight
you.
Yeah. So it seems to really mimic many different diseases. These are just some of the human symptoms continued. And of course, being exposed as veterinarians are to the amounts of animals, and I know that some vets say they spend, the vet techs are taking about 5 minutes to prepare the animal by taking ticks off them in June, July, and in August. So it's a big risk for everybody involved in the profession, oftentimes beginning in a bullseye rash, but really only 30 to 50% of those infected have this early warning sign. So how about that in animals? Are you able to get any sense of swelling underneath the fur or skin, or
not like what you're showing here? I mean, you get swelling from the tick saliva, an allergic reaction, but just to backtrack a little, what we had talked about earlier, when the book I read, that urine was a big way of this being spread. And when talking about techs and people working with animals, I never thought of that as being a way of it being transmitted, I guess. Even like
it's kind of interesting too, because Bergdorf Ferry, who ended up giving his name to the bacteria, believes that he was infected from a lab rat who holding it up, urinated into his eye, and he was convinced that he developed Lyme from the urine.
Right.
So the classic symptoms, moving through. So there's the concept of, it seems that everybody agrees on that there is this early stage, acute stage of Lyme, and then once it establishes a beach hole, it can hide out in, tissue that is not able to have very good blood supply and collagen, and maybe even go neurological, crossing the blood-brain barrier. So it does tend to kind of has the possibility of migrating into a real chronic condition and mimicking many other diseases. Oftentimes the first stage is, if we can stop it developing a beachhead, then that's the best protection. So the idea that it's called the great imitator, very similar in its look to syphilis, large spirochete, and the symptoms can disappear and then develop over months and reappear in more serious conditions. It's been linked to over 300 diseases in humans. Still very controversial. What we cover a lot too is how to protect ourselves and others. Certainly pets, in my mind, are absolutely the biggest danger to Lyme. Especially people who allow them up on couches, up on their beds. Do you find that a lot with your patients, that they're able to get up on couches and sleep with their owners?
Oh, sure, you bet, of course, yeah, including my own. but you have to control the ticks, there's no doubt. But it's amazing how many people up here have Lyme's themselves and their animals do at the same time. So it makes you wonder.
Yeah. So this is one study I found that it correlated tick prevalence in North Carolina in dogs to human Lyme incidence in the population, and there seems to be a direct correlation there, which I find really fascinating as a vector for this disease. And then here are the bad guys. These are the guys that cause all the problems. We had the black-legged ticks, the American dog tick, the Lone Star tick. These are the guys to watch out for. And then a tick life cycle. So we're moving through this quickly because we want to get to the heart of our discussion just by setting the stage a little bit. But the bacteria lives normally in mice, squirrels, and other small rodents. Transmission to pets and people is mainly through the deer tick. There are other methods suspected, like urine, other than the bite of a deer. The deer transport the tick, but apparently do not get anywhere near the infection of other species, including our own. And increased deer populations in small areas are also being a major factor. The increase in the wooded areas in deer over the last 25 years is really linked into the transmission of Lyme. And the canine symptoms. So what kind of symptoms are you seeing, Lee, in your practice around dogs?
Well, initially, when I first got to Maine, mostly lameness.
Yeah.
A lot of animals, when they're extremely sick, they're just lethargic, anorectic. They're down and out. They look like they're going to die. But what I've been seeing recently, which is sort of a little nerve-wracking, is a lot of animals are getting kidney problems. Going to kidney failure.
And how's that showing up? What kind of symptoms are showing up?
Well, it literally, they start vomiting, stop eating, and their kidney values go up. They're really sick, and a lot of the vets around with just the doxycycline, it's not helping the animals. But I found with using the herbs along with it that they've actually a lot of them have pulled through and done well. But that's sort of alarming because we're getting more of the kidney problems. But mostly, they just run a fever. Some of them have large lymph nodes. A lot of lamenesses. That's the major weight thing I think that we see. I have some that I've seen from the vaccine that have got a lot of neurological type issues, and that's another thing we can talk about later, I guess.
Yeah, and here's a figure that amazes me: that 50 to 90% of asymptomatic healthy dogs can test positive in endemic states. 50 to 90%. That's astounding.
Yes. Yeah.
And so they're coming in contact, kind of getting a balance with the bacteria through the immune system. So are the animals that you're noticing, Lee, are they immune compromised in some way? Have they gone through an event that's kind of bumped their immunity down and it's allowed the bacteria to come to the fore more? Are there any correlations like that in your practice that you see?
I see some. Most of the ones I see, once they're treated, they're over it. But I have some that do get relapses, and we might have talked about it before where, some of the people even say the full moon. I'm not sure why that works, but they get relapses. But once you get them on herbs, they seem to stabilize. I don't know if we're getting rid of it, but keeps it under control. But yes, especially with...
Well, it's a very tricky, bacteria, the idea of it going insisted in kind of, going into stealth mode and then hiding out from the immune system, really allowing a beachhead into, hiding out in tissues. They've even identified it in spinal fluid. They've identified it in, areas that don't get good blood supply. And that, it could be that some people believe that maybe, I'm starting to wonder if maybe 2 or 3 days a month it's active and it moves through the blood. It transports itself from place to place through the blood, but then goes into kind of stealth mode and hiding out in areas that without blood supply. And that's partly why it's very difficult even for animals that are on doxy for a while to still test positive and still have symptoms after the treatment with doxy. It's just not in the bloodstream for the antibiotics to get at.
I see. Yeah, for sure. That's why I think this talk is good, because these herbs seem to take care of some of those things with the microcirculation and, working more specifically on the immune system, specifically the CD57, natural killer cells, etc.
So as far as cats, how come the cats are getting off so lightly? Dogs and humans are
I don't know.
Now. So it's just something inbuilt into the immune system?
No, I think the cats are getting it. I just think they're not diagnosing it. I mean, I see a lot of these idiopathic type things, and I wonder, get these these things that have neurological symptoms. They go everywhere. They get MRIs, and nobody knows what's wrong with them. And I suspect that we're missing a lot of cases. Sure, but I think
any studies comparing cats to dogs?
I think the organism likes dogs and horses and people. Don't you think?
Yeah.
I mean, I know goats and cows get it, but it's not as prevalent. I think they just like certain animals, and there are enough around that they don't have to. I don't know. I'm not sure. But they have no tests, really, that I'm aware of that are very accurate for cats anyway.
So some of the other nasty things that go along with Lyme and co-infections are Lic.Ac, Borrelia burgdorferi being the Lyme, Bartonella, Babesia, and those are I guess the big four right there that are hitching a ride in greater quantities these days through the tick. And so the presence of co-infections. I mean, have you been able to go after co-infections or identify them either from a clinical picture or from blood work?
I have not personally. Maybe someone can contribute that, but I have suspected it, and I've treated them accordingly, and they seem to respond to it, but I'm not sure, honestly, because it's hard sometimes to get people to go further with testing as far as the cost of everything.
Yeah.
But
the 1 in 5 being seropositive is interesting.
Everybody's diagnosed anaplasmosis now up here. That's a biggie. But they're getting treated accordingly with a doxycycline, I guess. I haven't seen any, but a lot of vets around have seen it. I haven't gotten any positives there. But.
Yeah. So canine ehrlichiosis and also anaplasmosis, fever, swollen joints, positive ELISA.
Yeah, common. Yeah.
And so basically what we'll be covering this evening is this protocol of antibiotics if needed, also with Lyme support herbs, co-infection herbs. If there's a heavy antibiotic use, you also use multi-probiotics in your practice if you have to use Doxy. Is that correct?
Yes. Always. Any kind of antibiotic, for sure.
Bacteria.
Yeah.
And then what we've started to suggest and see good results from is using the broccoli sprout powder that contains 5,500 parts per million of sulforaphane, and it's this active ingredient in the 7 to 10-day-old sprouts that stimulate phase 2 liver enzymes. And of course, they help the animal hang out in a Herxheimer reaction, or help it detoxify from kill-off or byproduct of the kill-off in the liver. So it allows us to stay in the sweet spot of killing off the bacteria more effectively. With babesiosis, we see the malaria-like parasite hiding out in the cell there, and some of the symptoms: spiking fever. You see a lot of sweating, muscle aches, headaches. So it can be a very distressing, complicated picture. And then ehrlichiosis.
Yeah, I think some of the animals that are really sick and down and out, that maybe they have some of these co-infections. Just worse for wear just because they have both at the same time.
Right. And so in the human realm, they had a try at a vaccination for Lyme that was discontinued for all kinds of problems. It's very controversial now, and discontinued in 2002. So it's still present in the animal realm. Not the same vaccine, I imagine, but
right.
Are you seeing greater numbers of conventional vets using the Lyme vaccine?
Oh, I think most all of them do. I don't have it in the clinic, but we see so many animals that have been vaccinated that still get Lymes. Plus, I've seen a number of animals get sick. I've seen some die, and a lot with neurological symptoms. So it just scares me. And I don't know why they took it off the market with people. I suppose so many people are getting side effects. So,
and what about generally, when do you like to introduce herbs for Lyme? When do you like to bring them into the picture?
I bring them in right away.
Way up the Doxy.
I bring them in right away. I have a plethora of clients. Some they don't want any drugs in their animals. Some are willing to do anything you say. Some want just herbs. But basically, I start them right away. And if I get an animal that's not really sick, I'll just put them on the herbs. If an animal's really down and out, of course, I'll use the doxy along with them. But, the herbs are better because they just, they improve the efficacy, and they're more specific for all the problems that the Lyme's organism is causing with the immune system and anywhere in the body. So I just start them immediately.
The idea of the doxy over time really depleting the good bacteria in the stomach and in the small intestine, and that may be responsible for other kind of allergies. The partially digested food particles coming into the bloodstream from depleted good bacteria, protection in the small intestine. Kind of a leaky gut idea, and so there are consequences of using antibiotics for long term, which one of the advantages of the herbal realm is we don't have that.
Well, the other issue is, excuse me, I'm sorry. When I first moved here, all these animals kept coming in, had no symptoms, and they said the vets put them on antibiotics. And next year they were positive for Lyme's, no symptoms, put them on antibiotics, and it just seems like a theme. Whether it's right or wrong, I don't know, but it just didn't make sense to just keep doing that. And they don't really use, I don't know, maybe they are now, but they don't really even put them on the probiotics. So sure, it's probably why we're getting a lot more autoimmune diseases now too, a lot more. But,
right.
So
as far as nutritional support, the idea of keeping the animal healthy so it can stay asymptomatic and kind of achieve this truce with the bacteria. So the idea of that truce, what do you recommend to people whose animals tested positive for Lyme yet has no symptoms to keep their immune system up nutritionally? What do you like to rely on to help keep them at their nutritional peak?
Sure. Well, everybody that comes in the office, I try to get them on a more natural diet. I try to get them on a low-carb diet, which right away doesn't support the parasites because they like carbs and sugar to proliferate. And I use a lot of fish oils, and I basically use a lot of astragalus.
Yeah.
I've even used your formula with the astragalus and ligustrum a lot, just to keep them on it all year round, just to keep their immune system up. And a lot of greens, just like all the phytonutrients that are available. And I think the diet, and I try to minimize vaccines, which I think a lot of holistic veterinarians do. They just try to do the minimal amount and get them on a regular, low-carb, more natural diet. I have to admit I'm more into the raw food diets, but I don't push it on people specifically, but I like fresh food. I think they do better with it. And again, depending on if these animals have had the disease, I'll use a lot of the cat's claw.
Yep.
Just because it'll keep their immune system up as well, along with the astragalus.
Right, so the idea of keeping the immune system strong, keeping the nutrition.
And where we live here, because my dog has no symptoms, but she has a positive Lyme's, I just keep her on your Lyme support all year round, basically, is what I keep her on.
So, one of the major, LD herbal support, the Lyme disease herbal support, is Andrographis, which is absolutely one of my favorite herbs right now. I've been in communication with one of the top scientists in the world on Andrographis paniculata in Chile, Dr. Juan Hankey, and he was involved in the research back to the Swedish Research Institute where they were looking at Andrographis ganjang is the product that they produce for influenza, and what they found was that this herb was just a fantastic anti-infective herb, but also, Andrographis can modulate autoimmune response quite remarkably. They've been doing research on MS in Chile and getting great results with low dosages of Andrographis, and I think as many people know that in Booner's book Healing Lyme, Stephen Harrod Booner, he's a big proponent of Andrographis, but in very high dosages for the kill-off in Lyme. So what I'd like to position the dosage of Andrographis at is in the middle road between, because low dosage really helps modulate autoimmune response and high dosage helps kill off. So right at that cusp which is where we like to keep the dosaging of Andrographis, so that if the body is really trying to find the Lyme and kill the organism, that it doesn't overreact and go into an autoimmune response trying to track down something it can't find. But when the Lyme does bubble up into the bloodstream, even if it's only 2 or 3 days a month, that Andrographis is present for kill often. So it's that kind of delicate balancing act between that. And so some of the history on Andrographis is that it was mentioned in Ayurvedic medicine 4,000 years ago, and it is currently in like 26 or 27 major liver and anti-infective kind of formulas in the Ayurvedic system. It's crossed over into Chinese medicine about 2,000 years ago, and more recently has been used for to fight leptospirea, which is a spirochete that's similar to Lyme, and it's been used by a lot of practitioners to treat, and in fact 80% effective against leptospirea. It's also used quite effectively against malaria, so it's useful in case there is a co-infection with Babesia. And so it's kind of evolved from Ayurvedic medicine into Chinese medicine, where it's used as a major kind of clearing of infected heat, this concept in Chinese medicine of clearing heat that is responsible in the body for infection and supporting the bacteria and viruses. So it's one of the top herbs out of the Chinese and Ayurvedic stables for Lyme. So you use Andrographis quite a bit for Lyme, Lee, in your practice. Any other usages that you've
used it a lot for cancer patients. Yep.
For cancer, yeah.
Yeah, I've used it a lot. And it seems, who knows, when you have cancer patients, you treat with a lot of supplements. But yeah, I've used it a lot.
Yeah.
And they seem to handle it quite well.
So so if you see an animal and it's in an acute stage, and you kind of help it get out of the acute stage, are you recommending like 2 or 3 months to try to prevent it going into a chronic stage, into chronic Lyme? What kind of dosage and the length of treatment, I guess, is what I'm after.
For just treatment in general?
For Lyme in general.
Oh, yeah, probably 3 months for sure, and then I just put them on a maintenance dose. Yeah, definitely. I have to say one thing, that I have had some clients that did not want Doxy, and using the herbs, the animals, they weren't down and out, but they were fairly sick and lethargic and lame and fever, and they did really well.
That's fantastic.
And they came back negative on their Lyme's test next time around when we checked them. So that's the proof of the pudding to me, anyway.
That's
tremendous. I mean, it made me a little nervous, but they wanted to go ahead with it. So yeah.
And how often are you seeing reoccurrences? Animals are cycling through.
Not a lot,
Lyme
honestly.
flare-ups.
The ones that I've seen of reoccurrences are the ones that had the vaccine reactions. Those are the ones that got the neurological symptoms, and those were the harder ones.
So some of the other LD support herbs here are cat's claw is getting a lot of attention. The big debate, not so big now, but was on what type of cat's claw, if it should be an extract with TAO free. But it seems that the consensus, amongst Booner and Sputi Dominanda and other herbalists in the field, is that TAO has been kind of discredited clinically and a little bit from the study. There was one positive study on Lyme and TAO-free cat's claw, and people wondering if it was more of a marketing ploy. But so just the general use of cat's claw, really, helping the immune system, help to try to fight the stealth bacteria. Do you use cat's claw also in cancer in your practice?
I do. Yeah.
Yeah. So just generally to boost up immune system.
Right. Yeah. Exactly. Yeah.
So cat's claw is major.
I haven't used it separately. I've used it, in your formula. Obviously, it helps with the pain and the arthritis and stuff. But I haven't used it just alone. But I've used it in cancer patients. Yes. just for the immune system.
So we're trying to whip through it a little bit because we've got a little bit left in the seminar, and I'd like to throw open to some questions from people that they can type in the command bar on the right-hand side of the GoToMeeting, seeing if anybody wants to start submitting questions now. We'd love to take them between the two of us. One of the other major anti-Lyme herbs is Japanese knotweed, which is a nightmare down south because it's such a prolific weed, Polygonum cuspidatum. But so the Japanese knotweed's relevance to Lyme is stimulation of microcircuitry, trying to deny the stagnation that Lyme loves, especially in collagen in the knees and also into tissues of the heart and eyes, a lot of the head pain and is believed, to come from this around the eyes. It's classic with Lyme. And also delivering the active constituents. In Chinese herbal medicine, within the formula that we've been talking about, the LD formula, the use of this one is of a messenger herb too. And what I love about this is that it has in the natural realm has a lot of resveratrol in there that's been getting a lot of attention about boosting the immune system, but also crossing the blood-brain barrier. So I like the idea of linking Japanese knotweed with cat's claw and Andrographis, so it is able to take those herbs hopefully across the blood-brain barrier for neurologic Lyme. The herb has been used for centuries in helping heart function in Chinese medicine also, but protecting and correlating heart function. It's a wide spectrum, kind of low-level antibiotic, antiviral action, reduces autoimmune responses. The idea of the immune system trying to find something that's so stealth. Immune enhancement in general. So there are lots of good qualities to the Japanese knotweed. And when you start using these herbs, Lee, in your experience, is there any kind of detoxification or Herxheimer reaction that the animals is notable in animals like in humans?
There is some, but usually what I do is I've always put them on. I must have maybe used milk thistle and other, liver, like artichoke.
And artichoke and alpha-lipoic acid. Do you use that?
Yep.
Yep.
Alpha-lipoic acid, I use a lot of that, actually. And I don't see a lot of Herxheimer reactions. Not that I've picked up, but that's just my experience.
Yeah. Okay.
Or maybe we're just trying to maybe we're proactive that way, I'm not sure.
Yeah, so if that does show up, the idea of the broccoli sprouts and phase 2 liver enzymes we covered earlier, and there's a lot of research on broccoli sprouts and the sulforaphane, the SGS, that's stimulating phase 2 liver enzymes that's been done by Johns Hopkins University, and it's also major anti-tumor, anti-cancer, and there's some of the studies listed here, potent induction of phase 2 enzymes, and it's really the 7 to 10-day-old broccoli sprouts that has 30 to 50 times more sulforaphane than a broccoli floret, and so the producers of this are able to kind of guarantee 5,500 parts per million of sulforaphane, and that's the kind of magic number to help the liver detoxify and raise up its game to help immunity. And then going to the co-infection, so you were saying that you like to use artemisinin, which is an extract of Artemisia that the Chinese is a Chinese drug now. The extract from the herb is the largest selling malaria drug in Africa. So it's also been getting a lot of research into cancer, and I was interested to hear you say that you've been using it in your clinic for cancer.
I do. I've been using it for about 15 years, yeah. And like I say,
so Artemisia is one of the most. I'm sorry.
Go on.
So it's one of the most effective herbal agents for treating malaria, which is a parasite very similar to Babesia, and artemisinin is one of the active compounds in the herb, and it's become a treatment of choice for malaria now, also for Babesia in the co-infection. And Boneset is also targeting Bartonella and Babesia. So it's a collection of herbs for co-infection. LD-Co has been used for cat scratch as far back as 1899. So can you tell me a little bit about the challenges of co-infection in your practice?
Well, the challenges are getting it
Big
done.
Open-ended question for you.
Getting tests that reasonably priced and people are willing to do and that are accurate. Sometimes it's just a guessing game, basically. So I guess we just not.
It's more nearly always based on the clinical picture.
Yes.
What's showing up.
Yeah. And I personally have not, the only one that we've really seen in the anaplasmosis is the biggie, but I haven't really diagnosed the Babesia here, or the Ehrlichia is the big one, obviously.
Yeah. How about out west? Did you see any of the Ehrlichia out there?
No.
Yeah.
I saw a couple of cases, but they were not. They were animals that had been brought there from, I think, even down the Caribbean or somewhere. I'm not sure where they came from. Yeah. So that's not something I can help you with. The co-infection, I really haven't diagnosed.
So keeping the animals strong seems to be the name of the game in Maine for anti-Lyme.
Exactly.
And you were saying that you give your dog a Astragalus.
I just keep her on it all year round. Yep.
Yeah.
2 to her, 2 to me. We both take them.
But especially with all the exposure that you have as a veterinarian to ticks, too.
You bet. I mean, talking about the Astragalus, I know when we get these chronic infections, it's not a good idea to use it. But initially, as a preventative, it's a good idea.
Yeah. Yeah. Because you don't want to over-rev the immune system.
Exactly.
Yeah. So the idea, that in traditional Chinese medicine, this herb's been used for 2,000 years. There are, actually, I found 799 citations on Medline for Astragalus. In fact, Merck did a 2-year study on chemotherapy patients and concluded it was effective for boosting the T-cell count in chemotherapy patients in 9 out of 10 chemotherapy patients, but they had to drop it because it was such a complex structure, molecularly complex, that they couldn't find the active ingredient. So it's not really about getting rid of the infection, but boosting and modulating the immune system to further fight off the Burgdorf-Ferry spirochete. So the idea of TCM principle fighting infectious disease is about, boosting righteous T, dispelling the evil pathogen, which basically means, you're trying to use the host, raise up the host to fight off the guest, the evil pathogen. So, anything to add to what we've gone over, Lee? About how you use herbs before we go into the questions?
I think we've covered most everything.
Yeah.
Yeah. The only thing that I think that I found that I've been using for a while that I thought was sort of interesting is that vitamin E sort of pushes up the CD57 natural killer cells, and so I use a fair amount of that in my practice, and it also potentiates the action of the vitamin C, which is for the the connective tissue. So I use a lot of those 2 vitamins. I guess that's the only thing I could add, I guess.
Yeah. So the vitamin E is very interesting too, and you were also mentioning about C. How you use C?
Well, the C. Well, I mean, along with the glucosamine C, just to support the connective tissue. If you suspect you've got, I use it a lot of it anyway. But if you have an organism that likes connective tissue, like the Lyme's organism, then I think it's good just to support it that way.
Yeah.
So that's why I use those.
And so one of the things we'll be sending out along with the PowerPoint presentation is the article Sour Twist of Lyme, which kind of covers the herbal treatment, an article I wrote that we'll be sending out. So we've got a couple of questions now we're going to start to go to on this. I think on the screen right now. Is the screen sharing?
I lost my screen.
Okay, so on the application. There we go. Okay, so this is the article that we'll be sending out. But when we move to this, so we have a question here. I would never use the Lyme vaccine as a veterinarian, as this is no better than the human vaccine. The provocative lipoprotein antigen is what causes the immune pathology that defines the Lyme syndrome. So it's a veterinarian saying he would never use the Lyme vaccine. Is no better than the human vaccine, the provocative lipoprotein antigen that causes immune pathology that defines Lyme syndrome. What would you think about that question, Lee?
I don't quite understand. It sounded like they were making a statement. Was that a question?
Yeah, I think it was a statement, but
I don't have the vaccine
not
in my
using
practice.
the vaccine.
I wouldn't use a vaccine unless I was sure that there was going to be no deleterious effects. So, from my perspective, even if it protects some animals, or the animals that it's going to cause harm to, it's not worth it. It's just
So
I don't like the lepto vaccine either. Those are the two vaccines I see more reactions from, between the lepto and the Lymes. I get so many animals that get sick from it.
So you said you've had some bad ones too with the Lyme.
For sure. I've had a couple of animals that even came from Portland, a couple hours away, to try to treat them, that actually literally died after the vaccine, and a number of them got neurological symptoms with seizures and chronic ongoing things. So I've never had it in the clinic. So someday maybe if they get one that causes no, I guess I don't quite understand the question. So sorry.
Okay, I'm not sure I do either, but it's certainly, I think, more maybe of a statement that they're not using the vaccine. If anybody has a question, now would be the time to type it in. I can go through the article, too, that we'll be sending out as well. We're looking to, we got the box with the questions in a little stuck. We're trying to move through.
I was just wondering if anybody had seen a lot of these co-infections in their practices that they've diagnosed.
That would be interesting to hear back from people how they're dealing with co-infection. So the Lyme article that we're going to go over is that we'll be sending out. I'll just cover it quickly. Basically, summarizes Lyme and that, talking about the human symptoms more. This is a human-based article, but it does give some good background to Lyme. How fast is the danger growing? That there were cases, that 10 times, they think the number of cases may be 100 times higher than reported. That would put it around, 18 million in the U.S. alone. And I have an interesting story. In our clinic here in Natick, Massachusetts, I put out on a little sign one day that a newspaper published that 10% of one of our local towns had Lyme, humans had Lyme. And I put out 10% of Dover has Lyme on our little A-frame sign. And about 5 or 6 people walked in, 2 of whom said, no, on my street it's 20%. And the other 2, 3 people said, no, on my street it's 30%. They'd actually counted up the amount of people infected on their street. So it's really an unreported problem, I think, in many ways in the human realm and in the animal realm. And there's another study showing how quickly it is increasing in infection, that Lyme carried by the tick increased from 30% in, I think, 14 townships in New Jersey did a study, and they found that from 2004 to 2008, it increased from 30% to around 60 to 70%, which is kind of a frightening increase in the amount of ticks carrying the bacteria in 4 years. So I think we're going to hear more and more and see more and more, unfortunately, about Lyme. So we'll be sending this out to people, and we seem to have handled most of the questions. And so, Lee, I wanted to thank you very much for participating today and sorting out your computer with us and getting online and doing all of that. It was very kind of you, so thank you very much.
I appreciate it. Thank you.
Dr. Lee Herzig of Maine, Belfast, Maine. And we have another seminar. Our next seminar will be on immunosupport coming up on July 14th at 7 o'clock, and we'll be sending out a whole bunch of information. Okay, so we picked up some more questions here. So just before we leave, we'll cover them quickly. So we tend to treat them with doxy, even if they've been asymptomatic, having been burned on cases where we didn't start immediately. Your thoughts. So just to So yeah, I guess the knee-jerk reaction is to start treating with doxy, even if symptomatic.
Yeah, I don't think there's any right or wrong. I think that's one way of attacking it, or maybe from my perspective, I would maybe go with the herbs, especially if they don't have the symptoms. But, you know, it doesn't mean that's right. The thing is, with the majority of these animals that I've seen since I've been here that were positive, they never developed symptoms ever. But when you have someone like this that got burned, I can certainly understand that. I would definitely do something one way or the other, either doxy or the
or even combining the two, you know. I mean,
or the combination, and definitely just
it would be very interesting to see the difference between the two.
Sure, you bet.
And using probiotics with the doxy.
Definitely.
So somebody here is also saying they've been using ozone therapy. Have you heard anything about ozone therapy with other supportive herbs, and it helps? I
haven't personally. The one thing that I have used with some of these cases that were a little complicated, I've done some laser therapy.
Yeah.
I have a low-level
laser acupuncture?
Well, I do the acupuncture, but there are certain frequencies that will kill the Lyme's organisms. So I've been using that. And again, when you do more than one thing, you don't know what's helping. But when these animals are down and out, especially these kidney cases, they seem to respond. So, and I guess that's the other thing I didn't talk about, that if there's a specific organ affected, obviously you'll put them on a Romania-type formula or something else, depending. I haven't seen any heart cases that I've diagnosed, but neurologically, you can just support the different systems as well. So
as far as somebody asked about the maintenance dose, so, you know, generally speaking, you know, we tend to think of, you know, that you would use a much higher dosage in the beginning and then move into, you know, a half dosage for a longer period of time, usually about 1 or 2 months, 3 months. And if they're in an area where they're symptomatic or recurring, then I would keep them on it for at least 6 months through the summer. Have you any thoughts on that?
No, I agree with that 100%. Yeah, that's what I do. Or like I said, I just keep my dog on it most all year round.
So, as far as a maintenance dosage, then you know, we can think of, you know, 500 milligram capsule for a 10-pound animal, or the herbs sometimes it comes with scoops if it's a powder form, so 1 scoop being 1 gram for 20 pounds. And then I think that, you know, once you go through the first month, it's easy to come to a maintenance dose of half that for a much longer period of time.
Yeah, definitely. Yeah, that's exactly what I do.
So let's see if there's another question here. We're having trouble pulling up the boxes of the questions here. So there's a question here. What do you think about herbs as an adjustive treatment for zoonosis in cats? I have no experience with that. Do you, Lee?
No.
Zoonosis?
No.
I have no experience, so I don't really have a comment on that. Dogs that present with many signs but test negative for these diseases, could it be a subclinical without a positive test?
Oh, definitely. Oh, yeah. I've treated a number of animals that were negative that we suspected Lyme's. We just treated them because nobody could figure out what's wrong with them, and then all of a sudden they just respond right away. A lot of, especially lamenesses, you know, they've gone for MRIs and everything else, and nobody can figure out what's wrong with them. And, oh, maybe this dog has Lyme's, even though it's negative, and you treat them and they're better. And a few days, people are calling, they're better already. So for sure, there's a lot of subclinical, or not, well, I don't know if you're going to call it subclinical, but they're not positive. You know, they're not coming up positive on the test. That's for sure.
Yeah.
Yep, very common.
How accurate is the test? You know, I know that in, you know, the major testing in humans is 35% false negative. Any sense of what the accuracy runs with the test?
I don't. I can't understand why this one would be so accurate. Maybe somebody can answer that. And the human ones are so complicated, and that's where it's confusing for me when I first moved here. But basically, when I called the IDEX company, they said that unless you do the C6 antibody, these dogs just have antibodies against it, and they're probably just immune to the disease, and they don't even recommend treating them. So I think, like we said, a lot of these dogs have been exposed, but they built up their immune system and got rid of the organism, and they're immune to it. So the test itself, good question. I say it's not 100% for sure.
Yeah.
But percentage-wise, I can't say. Yeah.
Here's another comment, a statement from a veterinarian. It says, vaccinated dogs are so cell-mediated immune paralyzed that the intracellular organism is surely capable of running the gamut without a properly functioning immune system.
Yeah.
Vaccines shift the healthy Th1 cell-mediated immune bias to a very unhealthy Th2 humoral immune bias that lets inflammation out of control in the first place, and then squashes the ability of the vaccinated individual to deal with things, the things cell-mediated immune system deals with, viruses, bacteria, fungus, yeasts, parasites, internal and external, as well as intracellular organisms. What is necessary is a healthy cell-mediated immune system to deal with these, and that is removed with vaccinations.
Yeah. Yeah.
Sounds like something.
Yeah. It's got the right way to put it into words. Yep. It's perfect. Yep. No, right. Good.
I tend to agree with.
Yeah.
Okay. So, is there a maintenance dosage we covered? And if the C6 is elevated and dog is not having symptoms, would you still treat with antibiotics or just herbs?
Herbs.
And so you wouldn't use both?
Well, I've had good luck with it just coming down.
Yeah.
Obviously, if not, then we would go further, but I've had good luck. I haven't had to.
Okay. And just clicking through. Where are you ordering your herbs for your clients? So yeah, if you could tell us that honestly, that would be great, Lee.
Actually, I've been getting it from your company.
But also
before you got sick with Lyme's and got into this, I was still having you make them for me.
That's right. I remember you asking for.
You were making an anti-spirochete formula for me that I found online from this Seven Forest ITM, and they used similar. They didn't use the cat's claw, but they had the Andrographis and the Smilex and Artemisia, and they had some herbs in there like Forsythia and I forget Hu Chang. They had the knotweed. They had the Japanese knotweed in there too. So yeah, even before that, I was getting that from you. You were making it up for me specifically. So there's a plug for you.
Great. Well, thank you very much.
All right,
thanks so much again, Lee, and I really appreciate everybody listening in today, and everyone will be receiving a PDF of the PowerPoint presentation along with the article, Sour Twist of Lyme, and an article on the research review of broccoli sprout powder and sulforaphane. But again, thank you very much, Lee. I really appreciate your time today. And I appreciate everybody for joining us, and hopefully you'll join us again July 14th, 7 o'clock for a immune supporting herbal protocol. So thanks very much, everyone, for joining me. Thank you. Bye-bye.